Welcome, and thank you for joining us this afternoon. I'm Farrah Hunt Thompson, Director of Consulting with Greystone.net. After today's presentation, we'll be taking questions from attendees. To ask a question, please use the toolbox on the right side of your screen. And due to the size of attendees will be in listen mode only today to cut down on background noises. Also, there will be a short survey at the conclusion of the webinar, and we would really appreciate your feedback. I would like to welcome our presenters today, Taylor Hamilton, Senior Vice President and Chief Consumer Officer at Ballad Health. Taylor oversees the development of new and innovative interactions with patients and families, listening to the needs of consumers and physicians, and using those insights to develop an improved customer journey through traditional and innovative digital solutions. She leads the strategy of marketing, communications, physician outreach, patient experience, volunteers, pastoral care, and the consumer call center. Taylor has over 15 years of experience in healthcare marketing, communications, and operations, and is the co-founder and silent partner of a young biotechnology company focusing on the commercialization of newly FDA-approved nanotechnology medical devices. In addition to her experience in hospital marketing and operations, Taylor has been involved with 3 different startup companies. She holds a master's degree in biotechnology enterprise from Johns Hopkins University and a bachelor's of communications from the University of Florida. Bryce Cannon is president of Modea and leads Modea's client services, software engineering, and healthcare strategy practices. Bryce has spent the last 10 years in healthcare IT consulting, where he has been leveraging technology to help transform the industry. With a background in entrepreneurship and digital strategy, he is passionate about helping clients cut through the organizational clutter and use technology to solve real consumer problems. I'll now turn it over to Bryce and Taylor to begin this afternoon's presentation.
Thanks, Farrah. That was really great. I don't know how much we really need to we need to elaborate on this next slide, but we had it on here just to do a little bit of a visual intro of the two of us. So Taylor, I don't know, is there anything in addition to what Farrah mentioned that you wanted to add in terms of your background or sort of context here?
No, not at this point. We're really looking forward to digging into these slides with you guys and talking about our journey and how we've worked with Modea to deliver on our newly established digital transformation initiative at Ballad Health.
Yeah, great. Well, yeah, then let's kind of jump right into it. And Taylor, you and I had kind of discussed here, I think a great place to start would just if you could talk a little bit about Ballad Health as an organization. It's a relatively new brand, so I'm sure there's some here listening that don't know a ton about Ballad, but it would be helpful just to learn a little bit more before we jump into the details here.
Sure, happy to do that. Yeah, so Ballad Health is just 3 years old. We were birthed from the merger of 2 of the largest competing health systems in the region. Right now, we are made up of about 13,000 team members, 21 hospitals. We've got behavioral health, about 800 employed providers, urgent care clinics, children's hospitals serving the region. Our region is large. It's 29 counties, but just about 1 million people. We're spread out. We're rural. So there's a lot of opportunity for us in the digital world to be able to hopefully reach and connect and provide new ways of folks and our consumers to interact with us. What's really exciting and what was really appealing to me to join the team, which was one of the legacy systems to create Ballad Health, was the opportunity to leverage the new size and scope of the organization to create an integrated community health improvement organization. So our goal, much to the chagrin of our finance folks, our goal is to keep people as healthy as possible and keep them out of the health system. And that was really appealing to me, really exciting. And to be able to really dig into the technology and meet them where they are, I think there's a lot of runway where we could be helping folks stay out of the hospital for as long as possible. We can move on to the next slide.
Awesome. Yeah, that's hopefully really helpful context for everyone. I wanted to just level set a little bit with the group here, Taylor, on just what we're planning to cover today. Instead of the formal, here's our agenda slide, there's really kind of 2 big things that I think we're hoping everyone gets out of the discussion today. And, first and foremost, we're going to essentially deliver a case study on the consumer mobile app that we partnered to build and put into market. And so we're going to go through sort of the normal structure that you'd expect from a case study on what we did. But we also just, my assumption, or our assumption, is that there's probably a lot of the folks here today that are joining the webinar that are either considering doing something similar, embarking on a similar process, maybe have already started building an app or considering it. And what we'd really love is for you all to learn a bit about what went well for us and what didn't go so easily, and just help this group that's attending here today kind of get started and have some tools, a bit of a tool set to hopefully have a really productive process for yourself and project of building a similar tool. So Taylor, can you start us off here maybe by leading us through at a high level, what the vision was for Ballad as you began to embark on this process?
Yeah, absolutely. So about a year and a half ago, our board of directors got together and we really decided and agreed that we really needed to be doing something with our digital front door. So this is a relatively new world for the organization. As you are all aware, being in healthcare is considerably behind the rest of the world when it comes to consumer first strategies. So we really wanted to lay the groundwork and say, okay, what do we need to do to be able to meet consumers where they are? And obviously, the website is huge, and that's a whole separate conversation. An app, we just digging through our data found that a lot of people were accessing our organization through mobile or tablet devices, and then what would need to be included in those. At the same time, after rebranding everything and having the merger, we got on an integrated network, Ballad Health network. So we had two legacy networks. We combined networks. We replaced 15,000 computers, and we adopted Epic system-wide. The first round of Epic was launched last summer in July, and then we brought the rest of the organization up in October. With Epic, if you are familiar with Epic, and pretty much every EHR available, whether you have Epic or not, there is usually an app that consumers can use to access their personal information. Some of them are a little bit more sophisticated than others. MyChart's pretty cool. They have about 120 different features, and we don't have all those turned on yet, so this isn't all about that. But we decided we did not want to launch an app that wasn't going to be a part of MyChart, and we also did not want to launch just a MyChart app because that's not our brand. It's a service that's included in our brand. So we started doing a lot of different research, looking at our peers and industry partners, and found out that the majority of the folks that we talked to had multiple apps, some up to 5 apps to do 5 different things. And as a consumer, no one wants to do that. You don't want to have to open 5 different apps to figure out how to deposit a check online or see what hours of operation are for your bank or make an appointment with your bank. So we said, all right, we need our own app. And to create our own app, there's really 3 options. We needed to build it from the inside out, which we're not in the app making business. And a lot of people have tried that. It's very expensive and you require lots and lots and lots of people and a skill set that we just didn't have. They're out of the box solutions, which are great in some circumstances. But really what we were looking for this custom personalized experience was more of a container. And that's where Modea came in. And what we wanted to do is we wanted to create a shell of an app that was really cool, really slick, but provided us the ability to plug and play our tech stack where we could help deliver on the brand promise that we wanted to deliver to the consumer. So if Bryce, you want to go to the next slide. So you have to start out at the ground level. So, what is the voice of the consumer? Consumers are changing. We all know that. Healthcare is really shifting from the model of they need us to we need them, where consumers have a choice now. You can pick up your phone and very easily fill your prescription at Target, Walgreens, CVS, Walmart, Amazon. So, how do you become more consumer focused? So it needs to be simple, 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 simple. It needs to be convenient, and you need to be able to provide multiple choices for the consumer so they feel like they're getting the best deal and they know they're getting the best deal. Also on this slide are disruptors. We're all aware of these, and I'm sure in your leadership meetings we're talking about these all the time. Amazon, Google, Walgreens, everybody is coming to try to chip away at the hospital and healthcare side of things. It's a very big piece of pie, but where I think that the health systems have leverage is that we know our business, and it's a very complicated business, and we know our patients, and our patients' relationship is with their providers and their nurses and their frontline team members. So we really wanted to be able to tap into that to provide this really great experience for our consumers. You can go to the next slide. The few stats that really stood out while we were digging in is 50% of tech-savvy consumers would leave their doctor for a better digital experience. We also found out that 80% of consumers have said they're willing to seek care for minor illnesses at retail clinics versus going to a PCP. Speaking of PCPs, 45% of Gen Z doesn't have one and really doesn't plan on getting one unless they absolutely need it. And 70% of folks that have been surveyed, and there's multiple surveys I'm happy to provide where we're getting all this information, are more likely to select a provider if that provider is digitally connected to them through email or text messaging. Speaking for myself and a lot of folks that I talk to anecdotally, they really don't want to have to call an office and wait on hold to talk to somebody. They just want to be able to shoot a text or an email and get it done. So really that's our end game. So you want to go to the next slide, Bryce. So, what's our goal? Our goal is to become the trusted source of health information and the easiest place in the community to access the right care when and how they need it. We need to be transparent and predictability of cost. We need to provide as much connectivity as possible for the providers. And with that, we're hoping we can pull everybody together and then really hit on that goal that I discussed earlier, where we're becoming this health improvement organization.
Taylor, one thing I'm curious about that you and I've talked a little bit about before, but it's just, going back to the first slide about the nature of your market and the region where Ballad Health, basically the patients that you serve. Is connectivity different, do you think, in this definition for the region and how rural it is? And does that mean something different from a digital point of view than other more urban areas?
Absolutely. And I wish I could see everybody on the call. I wish I could see your faces, because one of the first questions I ask when I'm talking about our digital transformation initiative in this region is, who in the room or who on the call has worry or has to think about Wi-Fi connectivity with their consumers? And the last time I asked that question, I was in Chicago just before the pandemic. It was about 100-ish or so people. Not one person raised their hand. And where we are, a significant portion of our population lives in what is termed a Wi-Fi desert, and there's zero cell phone reception. These folks have to drive to their physician's office, to a library, or to a grocery store, or sit in a parking lot to be able to link up. That's proving to be, I don't want to say it's a challenge, where it is a challenge, but there's really neat opportunities that we're looking at on how can we connect with these people and meet them where they are. So while we're thinking through this, we needed to think about, okay, well, what are we going to do for the people that we've labeled as off the grid? And we're estimating about 25% of our primary market area is in a desert, a Wi-Fi desert. So 250,000 people don't have the kind of connectivity that everybody on this call has, because we're all on the Zoom meeting, right? So that is a really good point, Bryce. That's something that a lot of folks, I hope that no one else has to think through that as much as we've had, because it is a challenge, and I think an unfair disadvantage to those in those areas that don't have the connectivity that we all do.
Yeah.
So when we were talking about our digital transformation initiative, and specifically for the app, we're talking about our front door, digital front door. I'm sure we've all used that term a lot lately. Is we wanted to break it down to 3 categories, which is growth, transformation, and relationship building. So growth is creating a seamless consumer experience to drive the growth, satisfaction, retention, loyalty, and advocacy. We believe that we'll be able to drive growth for the organization if we can do the seamless consumer experience really well. If we do that really well, the downstream of that is to improve and transform the patient or the consumer journey. So how do you provide simple, personalized, and streamlined interactions to engage, empower, optimize, and transform someone's health and wellness journey? What does that look like? Every single journey is different. My journey is going to be different than Bryce's. My journey would be different than my best friend's, who is my exact age, with the same number of kids, who's been married the same number of years I've been married. Everybody's going to be different. So how do you deliver on that? And once you figure that out, so once you have created a seamless experience, you're improving the journey as part of the downstream effects of this great seamless experience, inevitably you're going to help build those relationships, and building that loyalty in those relationships is inevitably what our goal is, right? As all of us on this call, is to really work on that brand and deliver on that brand promise, so you can continue to build these relationships. And easy as possible. The apps that I use on a daily basis are the easiest apps I have on my phone. If they're complicated, I bail and I don't go back, and I usually uninstall them. And Bryce will get to that. And we've had some lessons learned that we're going to share with you. So to be successful, we need to listen, and we need to listen to our consumers. We need to know our consumers. That's their data. We need to inform or communicate with them. We need to engage with them. That's 2-way, and empower them. And then we need to support them and our team members. And I throw our team members in there because our team members or our employees are consumers as well. But also, a lot of our digital transformation we're doing, we have an internal focus, and we have an internal app that we recently rolled out with Modea as well, with Bryce's team. So we really believe that, these are the 3 different buckets that we're primarily focused on in our digital journey.
Yeah. I think you already covered this a little bit, Taylor, but maybe you could talk a little bit more just about some of the things that drove you towards a mobile app specifically.
Right. So when we were digging through, a lot of your analytics are going to be on Google Analytics, which is it's a free tool if you're not aware of it. And what we found is, and to help justify the expense or the investment of the app, was, well, how many people right now are accessing and looking for Ballad Health on an app or a tablet or a mobile device or a tablet? And we found that over 60% of the traffic that we're seeing to our website was on a mobile device or a tablet, which is big, and it's growing year over year. It's continued to increase since I've been here. Also, with any EHR, your engagement is huge. It's something that is one of our KPIs. It's something that we measure at the end of every month. We look at it, and our engagement wasn't great. It was okay, but it wasn't great with MyChart, and that's simply because we weren't pushing out as much. It wasn't personalized. It wasn't branded for our organization. So we saw that as something that we wanted to address. And then conversion of our Find a Doctor. Also through our analytics, we saw that we had over 4,000 people every week visiting our Find a Doctor tool. They were going onto our website, mostly on their phone. They were looking for a physician, finding a physician, and then there was no conversion because there was nothing to do after that. So in a perfect world, which is where we are, almost where we are, they have the app, they find their doctor, and now they're being converted into appointments because we're bringing up our online scheduling. We have transparency. What are the star ratings of the physicians? All the information that we have gleaned from analytics that our consumers are interested in, we're starting to deliver on the app, and it's starting to show promise, and everything is heading and trending upwards. So we're really excited about where all this is headed.
Awesome. So I guess I'll jump in here now in this next section and just talk a little bit about the approach that we took of taking those goals and everything that you just described, Taylor, and coming up with a product strategy and what we wanted to go to market with. So So as Taylor sort of described up front, there was a pretty clear vision of what she and Ballad Health wanted to do here with the mobile app, and had already thought through different options. And we had some initial discussions about the high level approach to take, because there are a bunch of different ways you can attack the mobile app space here, as Taylor described. And she really presented us with this challenge of, okay, we want to have, I think you called it a container type approach, Taylor, of just, an app that we can build and manage, but that we can bring in all these other sort of third-party technologies and tools that are already at our fingertips, and create just a really sort of seamless experience that feels like one app for the consumer. And there are examples of that in healthcare. There are good examples of other health systems that are taking a similar approach. But one of the first things that we like to do from a Modea point of view, and I think this resonated with Taylor and Ballad, was just not just looking solely at what's happening in healthcare. Let's look and see what great consumer experiences are out there across other industries too. So for us, we always bias towards what we sort of call high trust categories first and foremost. Other ones like healthcare, that it's a considered purchase. It's something you're really going to do a lot of research. There's a lot of tools that could be really useful in the process and the journey that you're going to take as a consumer. So though none of these are a direct analog or direct comparison to healthcare, there are some helpful things we can tease out of it. So whether we're looking at the automotive industry, real estate, financial services, or hospitality, there are elements of each of those that can be really compelling as we think about a great healthcare consumer experience. And then, more specifically, we wanted to start to hone in on some of these and say, okay, well, when we look at mobile and the mobile app space specifically, what kind of tools are out there that these very consumer-centric organizations are putting in the hands of their customers, and how they approached it, and what are they doing really well that we can, for lack of a better term, steal from and bring into our approach and design process and technology process as well here. So these are just a few examples. I mean, I think from the automotive industry, there's a lot of great stuff to glean in terms of, how do you look at sort of the maintenance and the record element of it. So the analog here would be the EHR info, right? Where if you're managing, using this CarMax example, just the health of your vehicle or the maintenance of your vehicle, there's both in terms of the design structure and how they present that information, as well as the way that they're pulling that in and keeping it up to date and making sure that it's sticky. There's some really compelling things that they're doing there. It's solutions like the Marriott app from a hospitality point of view. The thing they do really well is when you think about the journey end to end, there are digital interactions and there are non-digital interactions. And when you use a tool like this, I think a great example with Marriott specifically is just how you can use the app not only to book a stay, but when you get to the physical location, you can use that same app to unlock your door and pay for things and do a whole lot of other, complete a lot of other transactions that are not inherently digital, but the digital supports that step of the journey. So that was really kind of compelling for us to think about here as well. And then lastly, financial management or your banking apps. I think we all use those at this point pretty significantly. And there are a lot of great things to look at there in terms of the direct relationship with bill pay, obviously, in healthcare, but also just a lot of other things in terms of managing your financial health is pretty similar to sort of managing your physical health, right? And the way that they present information and make things really easy and simple to do is compelling for us to look at. So that was sort of the inspiration that led to us moving down a certain path here. And then, what we really sort of unpacked was a product strategy that was focused on, we look at these experiences, the things that they all do really well is they give you the convenience-oriented functionality that's going to let you do things like book an appointment, find information really easily like locations and providers, transact simply with bill pay and different transactions like that. While at the same time marrying that really nicely with the utility-oriented stuff. So your health record, information about you that some might not change all that much, but some is going to change and update over time as you have more interactions with your health system or your provider. So historically, as Taylor mentioned, those things can be pretty distinct and separate experiences, right? You might have a lot of the convenience stuff being driven on the web, or a mobile version of the app, or maybe already existing in a separate mobile application where you're doing appointment scheduling and find a provider. but oftentimes consumers are leveraging the MyChart app or some other utility for managing their health record information. So what we want to do here was really bring these two together in a seamless experience, and therein lies the sort of core complexity here as we tried to figure out, okay, how are we going to do that really effectively? So before we get into the design and where we got to in terms of the visual and the look and feel of this application, how we would represent the brand effectively across these two things, I first wanted to talk a little bit about technology, because I'm going to go on a limb and assume that a fair number of you, if you're considering doing something like this is one of the things you're really either concerned about or just think you really need to think about before you go down one path or the others. What technologies should we be using if we want to bring the EHR together with sort of essentially some custom application features like this? How do we do that in a smart way? So for us, there are really two big parts to this. First was what technologies and how do we want to approach building sort of the core foundation of the app? And there are two different ways to do that for the most part. One, and this is the approach that we took here, and the logo you're seeing on the screen is for a technology called Ionic, which is a UI framework, mobile UI framework that allows you to write one code base and deploy it across multiple ecosystems. So deploy it to the Apple App Store and that operating system, and also deploy it to the Android Google Play Store and that operating system. So you can really, for the most part, manage one code base, but from a speed to market and efficiency point of view, get it into the hands of different types of consumers using different platforms. The other approach would be to write a sort of separate native application for iOS and a separate one for Android. And that has its merit in certain circumstances, particularly if you're really needing to do a lot of complicated stuff interacting with the hardware on those devices. But in our case, and I think the case of most applications like this in healthcare, where there's just a robust cross-section of functionality, from our point of view, in most cases, makes sense to start with a cross-platform framework like Ionic or some other similar tool here for efficiency, speed to market, and just sort of keeping the code base as simple as possible. So that's part one, making a decision on what the foundation of your app is going to be. And the other big decision to make is integration. And as Taylor mentioned, there are lots of other tools already out there in the Ballad Health ecosystem that we knew to make this a compelling and seamless experience for customers, we're going to have to bring them in a thoughtful way. So I've got the sort of big three listed on here. There are others, but these are the most significant integrations for us in this app. The top logo hopefully is familiar to most of you, at least those that are using Epic, which is the MyChart mobile logo. And I'm going to come back to that because there's a lot to unpack there. The second one is Drupal. So that's the content management system that Ballot uses to manage all of their web properties. So that was a critical integration so that we could get information and content that lives on the web into the app really easily. And then the third one is their Find, which is Ballot's provider data management solution. I think locations get managed in there as well. But that was another critical piece, like Taylor mentioned, in terms of having to find a doctor solution, find a location, those sort of things that could really be built into the workflow within the application and make it a really seamless experience. So thankfully, those latter two, Drupal and Find, are really straightforward because they have APIs that are really easy to use and modern, and allow you to pretty easily and effectively bring data and content into an app like this that you're building. That's not quite the case with MyChart. So I'm gonna spend some time here talking through how you do it from an EHR point of view, and what are some of the options available to you if you're considering trying to integrate MyChart or really any patient portal mobile solution into your mobile app, your branded mobile app. So first, and I'm using the terminology that Epic uses here to keep it simple or to hopefully align with any conversations you might be having if you're talking to Epic. But so the first approach, and candidly, this is the one that Epic pushes you towards, is they call extended app. And that's basically, okay, maybe you have an app that does find a doctor and does other things like that, and you wanna bring MyChart into that. So from an integration point of view, what what you can do is just simply link users from the app out to the web browser version of MyChart, or to download, or if they already have downloaded, the separate MyChart mobile app. And you know, the pros to doing this are simplicity and speed, and it really limits the amount of sort of development work to do that. The negative, as you probably can glean here, is just that it's not a very connected user experience. It's not a great user experience, right? You're in the app, you're doing other things, finding a doctor, etc., and then you want to interact with your health record in some way, or some functionality that lives within MyChart, and suddenly you're getting punched out to a completely different experience, either to the Safari app to do it on the browser, or to the MyChart mobile app separately, and you're in a different app at that point. The other end of the spectrum from that is to completely create a custom application experience, right? And in a completely custom sense, bring all the functionality of MyChart into your app. And so in this case, the most common way to do it is to leverage FHIR API resources that Epic has and can make available. This is certainly the most complex and high maintenance way to approach it, but it does give you the most flexibility in terms of creating a truly custom, very branded and tightly integrated experience between MyChart and the other functionality that you're building in your mobile app. The big downside here is, you know, there's a couple things. You know, there's the complexity of doing it, and you have to have the development team that really understands how to use FHIR APIs and HL7 and all those components of that technology. The other thing is Epic doesn't have as a robust package of APIs as you might desire, and their maturity with FHIR is not as far along as you would hope in terms of bringing everything that MyChart can offer into your app. So if you go this path, you're going to be limited by what MyChart or Epic has available in terms of FHIR resources to truly in an API way bring that functionality and data into your app. So there's certainly some limits there. The third approach that we actually ended up taking here was to try to sort of meet those two in the middle. And so what we did was we built functionality out in the app using Ionic, and then for everything MyChart related, we were able to get access to the MyChart mobile SDK from Epic and leverage that software development kit to bring the functionality that Ballad wanted into the app that was MyChart specific functionality. So the positive there is we have the most flexibility in terms of what we can choose to bring in or not. And you just bring those into the app using what they call mobile libraries. It's just sort of code snippets or pieces of the code base that you can bring in from the SDK. The downside is you don't have complete control over those things. It's Epic's MyChart SDK. So when you bring them in, though you can make it feel like a connected, integrated experience where one step to the next is not disjointed, you don't have full control over the look and feel and the way that those features are presented. So a good example would be appointment scheduling. If you're going to bring appointment scheduling that is facilitated by MyChart into your app, you have to live with sort of the MyChart structure and UI for how to do appointment scheduling within a mobile app. But you can simply connect it and not have to punch users out to a separate experience to do that effectively, which is a big gain here. And I think for the most part, we were able to integrate it in a way that it doesn't feel disconnected. So with that, we want to talk a little bit about the solution that we ended up with. You can obviously go to the App Store and check these out yourselves if you're interested. But Taylor, I was going to kick it back to you to see if you just wanted to talk about sort of the initial version of the app that we went to market with last year, and sort of how we from there.
Yeah, absolutely. So we've been working with Modea for quite a while, and called them and said, you know what, we're getting ready to finalize everything with Epic, and Epic is pushing hard, and our senior leadership is pushing really hard for us to launch and start branding the MyChart app to our patient population of about 1 million. And I didn't want that. I wanted a Ballad Health app, and everything that Bryce just said, we took into consideration, and met with the team and said, okay, what could we do that would provide a custom experience for Ballad Health, but integrates the MyChart experience, which is really what we needed to get off of the ground in July of last year. And that's what is available here. So what we did is, when you download the app, and as Bryce just mentioned, and anybody is welcome to do so, when you download it, there's a couple more features that have been added since then on the home screen. But the home screen provides a login option, which is essentially logging into your personalized EMR. That's the second one. This is the second screenshot that you see right here in the middle. This is pretty much everything that we pulled in from MyChart out of the gate, which is looking at your current appointments, messaging your provider, paying a bill, managing your prescriptions, those sorts of things. There is an option that you can sign in as a guest, so you can still pay your bill and schedule appointments without having to log into MyChart. And through our research, we found it's about a 50-50 split of people that want to log in versus not log in. So we wanted to make sure we were meeting our consumers where they were, and you don't have to log in to be able to interact with us. And then the third screen, which was, this is when you're within the MyChart experience, is looking at just your history. This is past appointments, current appointments, and then future appointments. And then also, as at the bottom of the screen, scheduling an appointment. Bryce touched on something a slide or two ago about the scheduling component. And if you are working with MyChart, they have a scheduling feature, and it works. It's okay, assuming your physicians are okay opening up their schedules, which most are not. However, it is a template. And what we have found, and of course every health system is different, what we have found is the template is not a one size fits all for our organization. So we've actually disabled the schedule an appointment within MyChart and are working on a solution with our external facing non-Epic providing scheduling tool. We have a partner, another vendor, that we're actually going to pull in and use as like a parent-child relationship within the MyChart experience. So whether you are logged in and you're a current patient of Ballad Health and you're using the scheduling appointment tool in the app, versus you just do a quick search of primary care near me, you just move to the region and you go to the website tool, it's going to be the same experience. And we really want to make sure we're delivering the same experience no matter which platform you're on and whether you are an established patient or a new patient. We want everyone to be treated the same. So our go-to-market strategy was pretty much right out of the box for MyChart, basic functionality. It was successful. And then after we got our hands on that, we continue to add features monthly. Are you going to talk about these slides, Bryce?
Yeah, I can speak to this one, Taylor. So
Okay.
I talked a lot about the technology, but from a design principles point of view, these are some of the things that we really took into major consideration, which was, one, we wanted to make it, as I've said many times, feel really streamlined and branded, and that was important. And you lose some of that when you bring MyChart components in, because you don't have complete control over the look and feel. We did our best to try to tweak what we could to make it feel similar to the rest of the app from a branding and sort of user interface point of view. Definitely tried to be really clear with the calls to action and differentiate. And this is maybe apparent when you look at just the visuals of the app, but there's sort of there's sort of two big sections to it. The top we really reserve for the important calls to action and the things that we wanted to drive users to really do or consider, whether it's requesting an appointment or sending a message, those types of things. And then the lower half was more dedicated to the health records. And as the functionality grows and bringing in more MyChart features, something that would be scalable in terms of giving users really simple and easy access to their health record information and be able to keep up to date with that. So that gets a little bit into just the third bullet here, which is just having a good, strong hierarchy of information that is going to make sense to the users as they get in there. And then just trying to keep the pathways as simple as possible. It's really easy to get complicated quickly with these things where they have to click a whole bunch of times deeper and deeper into the app to get what they're ultimately looking for to try to do. So that was a big consideration for us. Like, how much can we bring to the surface How much can we keep it simple so that we're not obfuscating functionality or content or critical information behind layers of the app? And the rest of it is really just let's be thoughtful and simple and clean as much as possible while staying true to the Ballad Health brand and making sure that those branded elements are really coming through. In this, I know this is a little bit of an eye chart, but Taylor talked about ongoing enhancement. And it was definitely a challenge to be pushed as quickly as we were initially to try to get the app into the stores in alignment with the Epic rollout stuff that was going on at Ballad. I think we had an initial 3-month timeline or something like that to get the first version live. But what that actually gave us, the silver lining of that, was that we could quickly have a full product in production, in the hands of customers, get feedback on that and learn what was working well, what was not, and then iterate really rapidly and consistently. So pretty quickly, this is what you're looking at is the initial information architecture of the app, and it looks like a lot, but most of this stuff is really on that first landing page and is only a click or two away from once you logged into the application. And as Taylor mentioned, there are some logged out features that were available to users as well. But what was great is we were able to really quickly iterate on that and start to move things around and figure out, both from feedback and user data, as well as just things that we had already planned to do on the roadmap, evolve the app rapidly and make it better and better week by week, and push out new versions of the app as necessary. So here you're seeing a bit of a reorganization of that information architecture. We had to, because the app was scaling and getting bigger and more robust, figure out a cleaner way to represent the health record information, and also bring in some new features like find a doctor, find a location, seeing test results, and other things that we needed to make sure we were accommodating in the experience. So that's been both something that I think would be a big consideration for anyone doing this, is try to get to market as quickly as you can, within reason, so that you can learn from what your customers are doing and what they really want and their needs, and begin to just get into that cadence of iterating quickly, because we found certainly the longer you toil and just trying to get that first version out there, the more often you're creating functionality that your users don't really even want or need. And Taylor, I don't know if you want to talk a little bit about the current state of the app, but if you go to download that, it would already look a fair bit different from that first slide we shared. And this is where you can start to see some of the find a doctor stuff coming in, and it just growing rapidly as we learn, right?
Yeah, so the app has been in market since July of last year, so it hasn't even been a full year. And I checked data yesterday because we have a presentation to our board of directors next week to hopefully approve additional dollars for our next fiscal year to continue with enhancements and add-ons. But we've picked up almost 35,000 users since July of last year, and they're averaging 13 sessions per user, which is high. Epic aims for 3 sessions every 12 months per user, and since one of the main features is MyChart, we're well above the standard that Epic would consider to be good. So we're really happy with that. And then our uninstalls are only at half of 1%, which, the industry average is almost 28% that we have found. So we're feeling really good about what the consumers are looking at. Some of the things, as Bryce mentioned, the listening that we've done is driving our enhancements. So further integration and functionality of our Find a Doctor tool. Online scheduling is huge, and I'm going to keep going back to that because it has been a bear of a project operationally to get the physicians bought in on, this is the future. We need to make sure this is available, and then customizing those within Epic, and then pushing those from Epic into our MyChart or our online scheduling too, that would display in an easy manner on the app and as well as on our website. And then locations. Data is so important, and we're going to get to lessons learned here in just a few minutes. But if you don't have good data, none of this is possible. And a lot of what we've had to do is make sure our data is accurate, and not just our data internally, but what's being pulled up on Google, what's being pulled up on Yahoo and Bing and all of the other different search platforms. So data, and I'll continue to beat that drum as long as everyone will listen to me. But the locations is important, and geo-targeting on the locations is important. I mean, we want to get to a point where you can search in the app, urgent cares near me, and the closest urgent cares with current availability pop up. You can either hold your place in line, or it'll give you directions to get there as soon as possible. So lots of really neat ongoing enhancements. We have regular meetings with our internal digital team, as well as Bryce and his team, and weekly, if not more than weekly. I think actually some of his folks talk to our folks multiple times a day. But that's the nature of being digital, right? It's saying that you're digital and actually doing digital and being digital, I think, are very different. And I would say that Ballad Health, it's taken over a year, but I would say that we're actually starting to be digital, which means it's becoming an organizational focus where everyone is thinking, okay, how can we improve a process with being digital? Is this something that would benefit the patient or the team member? How could we integrate this into the app? Do they have the necessary, does a vendor partner have the APIs or the technology available that Bryce's team can tap into and create this user experience that we're hopeful for? So a lot of ongoing enhancements. And I would say that this is one of those living projects, just like your website, that you're never done. There's really, you could do as much or as little as you want with it based on utilization. What are your team members saying? What are your patients saying? What are they actually using? Really good advice that Bryce gave us, because we're really interested in personalization, is, we don't want to start off on the Rolls-Royce version of personalization, because maybe not everybody will want that. It really depends on, the user and where we're located and everything else. So we're going to slowly start pushing out personalization. We're going to slowly start pushing out real-time feedback, like one questions here and there, so we can deliver on this promise that we've built up, that we're trying to deliver on.
Thanks, Taylor. That was great. Yeah, and I'll add from a personalization point of view, I think there are several reasons to maybe take it slow at times. Just the other is just organizational readiness. Do you have all the content? Do you have all the structure and even technologies ready to go to be able to turn that on? Because we found others that we've worked with or are aware of that have made a big investment and just not been prepared organizationally to get what they want out of it. I know we want to get to questions here, but I wanted to hit on, so you already covered some results, Taylor, which was great. We've got a few slides here just to share some data with the group. It's been a really positive experience in general in terms of what we've been seeing, usage of the app, and some of the data that we've been looking at. I will say, and I'll get to this in the lessons learned, it can be challenging to get the data. So we'll talk a little bit about that, and if anyone's considering going down this path. But in terms of what we were seeing, as Taylor mentioned, really strong engagement. It's even better than what I have on here in the slide, is the latest data. We've seen really solid interaction, better than we expected with some of the transactional features like bill pay here in this example. 41% of users using the bill pay feature is definitely beyond what I think we would have expected initially. And then not just engagement with MyChart, but we've actually been able to drive through the app a lot of signups, new MyChart users, which is pretty compelling. I know for Ballot and you guys as an organization, in terms of getting more people interacting with and using the health record, yields better results kind of across the board. I also want to share a couple of things that were, not as positive perhaps, and things that, definitely were learnings for us initially as we looked at the data specifically. One is, so far we've seen not as great usage of the Find a Doctor tool and some of those features similar than we would have expected out of the gate. It's growing and it's getting better, which is great. But we expected, I think, immediately just really strong engagement there. So we're sort of investigating that, testing it, trying to get some more voice of customer information to just understand, why that might be, or if it's just the nature of this type of tool. And then the other thing that happened mostly out of the gate when we first went live, and we had to really just work on more from a technical point of view, is dealing with the app crashing. That was largely related to the integration with the MyChart SDK. So another watch out, I guess, for the group here is if you're going to take a similar approach to this, definitely make sure you do a lot of testing as much as you possibly can around specifically the authentication into MyChart for users, and be prepared for some crashes initially that you can be resolved, but it just requires some troubleshooting and some. It's one of those things where some of it, until the app was in production and being used by users, there was no way to really get ahead of it or catch it, but we had to just really be quick on our feet and nimble and resolve some of those challenges quickly. And then I think we could probably tag team this one here a little bit, Taylor, but we definitely had some big lessons learned, or just some things that I think would be really important considerations for anyone who's going to potentially do this type of work, build an app like this. Just a few principles, I guess. So I'll go through these and then feel free to add some color, Taylor, from your perspective. But first and foremost, get to the app stores as early as you can. And I don't just mean speed to market in terms of getting to production and getting it to end users, but you can actually submit and sort of publish your app to the app stores for review before you actually make them live and accessible to end users. And that's important because particularly with Apple, they can be challenging in terms of just going through their approval and review steps to even allow you to publish the app in their store. And we've dealt with that a little bit more acutely on the internal team member app that you mentioned, Taylor. But on the consumer app, still, like basically with Apple, be prepared for them to kick it back to you, and you have to change a couple of things. Or orient them, the App Store, Apple App Store reviewers, before you can get it to a state to go. So doing that early, or as early as you have sort of a full featured app, is helpful because you can get ahead of some of that back and forth that might end up happening. Usually Google is pretty quick and easy, but Apple can be painful. I mentioned a couple slides ago that we got great data. It took us a while to get there. And the main reason for that is that the app stores are not great about just giving you a really easy way to extract their app store data and all the data that they're gathering on the users of the app and getting it into, say, a BI tool that you might use, like a Tableau. So we had to do a lot of hard sort of manual effort to get all the data we could and get it into a form where we could present it to Taylor, present it to the team, and she could actually leverage some of this data to put in front of whether it's the board or other key stakeholders of the app. So there was a lot of work there. So I would just recommend think about your measurement strategy, what data you're going to want when you get to market, and start planning about how you're going to do that as early in the process as possible. I already mentioned authentication can be tricky. You're leveraging MyChart's authentication technology to get users into the app, and there are some handoffs that happen there between the app, sort of the ionic code or the app code in our case that we were building versus what's coming from MyChart. So that can be complicated. Definitely start that early, figure out what your architecture is going to look like, and do a lot of testing of it as much as you possibly can. And lastly, and maybe most importantly, whether it's MyChart and Epic's patient portal or Cerner's Healthy Life, or whatever EMR you might be on, and their corresponding patient portal, definitely make sure you're in lockstep with their release cadence and new code that they're putting out for features that you're leveraging in your app. That's going to be critical that you stay aligned with them, so that you don't get out of sync with what updates in code might be coming from Epic and pushed dynamically to your code base and could break things. So just tight communication there is pretty important. Epic's pretty forthright in terms of their roadmap and their features that are going to be coming out on generally a quarterly basis. So it should be, for the most part, is pretty straightforward. But there were a couple things here and there that we learned the hard way in terms of making sure that we understood really clearly what changes might be coming up with MyChart so that we could get ahead of it with the app and make sure nothing breaks for users. Anything you would add to that, Taylor? Those things, or anything else in addition to that you would want to call out?
I don't think so. I would definitely build time in to what you're relaying to your leadership team, because as Bryce mentioned, Apple, for how wonderful they are, and I'm sure most of us use their products all of the time, they kind of play by their own rules and their own timeline. So definitely build in some padding there, especially since it's complicated. And from what I've learned there's a lot of education you need to do on digital with either your executive leadership team or your board. So the more time you provide yourself to do the education, but also having to do with the nuances of Apple kicked it back and we had to change 3 things and send it to them and they sent it back. We had to change 1 thing, we sent it to them and then they sat on it for a week and now it's approved. I mean, the back and forth just really isn't necessary. So what we've learned and we continue to learn is we just have padding now. And if we can bring it to market sooner, then that's wonderful news. You can run up the flagpole and say, hey, look, this is what we're ready to do this thing. Let's get it done, versus having to go and say, well, Apple didn't approve, this one little thing. So now we have to change it and then resubmit. So I would say, on top of what Bryce said, just allow yourself a little extra time, because technology changes very quickly, but at the same time, this is not just an internal process. You're really relying and leaning on your partners, including your app stores, to make things happen. So that would be one thing I would add.
Yeah, I couldn't agree more with that. All right, this is our last slide, and then hopefully we'll have a little bit of time for questions. But anything you want to say here, Taylor, just in terms of the ongoing roadmap that we haven't already covered?
I don't think so. I mean, this is fairly self-explanatory. This gets back to what I mentioned at the very beginning about, laying the foundation. I mean, you have to, what are your patients and consumers going to your website for or coming to your app for? For us, it's finding a physician, paying a bill, scheduling an appointment. So with that, once we have those figured out, then, how do you weave in and layer on top like a really seamless, really neat virtual visit, triage, like self-triaging through a bot or some sort of form of a chat where it can direct you to the care you need or set you up an appointment so you're not even having to go to that next step with that low acuity care navigation. And then I believe there's one more slide, Bryce, right? Or is this the last one?
I think this is the last one, yeah.
Okay, yeah, this is the last one. But really, laying this out, and this makes it look like, oh wow, they're only doing 7 things in 2 years. But I would also caution you when you talk about online scheduling or you talk about let's do this app. I mean, our app's a 2-year-long roadmap right now because of everything behind the app that must happen to get it out to that consumer-facing button that appears. So while it just looks like there's 7 things that we're highlighting here, it's really hundreds of projects behind each one of these and various levels of the organization, cross-functional teams across everybody that have to touch it and approve it and look at it and make edits and changes. So I would say that if you're going to do this or you've already done this, make sure that your roadmap is a good place. You've got buy-in from your leadership team on your roadmap, and you're working really closely with your tech partner, whoever's going to help design and roll this out, that it makes sense and you could deliver.
Awesome. So Farah, do we go back to you now in terms of just how we want to handle the Q&A, if there is any?
Yeah, so we did get a couple of questions that came in throughout the presentation. And if you have a question, please, submit it in the toolbox on the right-hand side of your screen. If we can't get to it this afternoon, the questions will be available to us on the back end. So Bryce and Taylor can reach out to you individually to get your question answered if you have one and it just doesn't get put in this live Q&A. So we do have a couple of minutes for some questions. One question that came in was dealing with the differing needs between stakeholders and consumers. So how did you guys manage those for the mobile app? And then what was the process taken to manage expectations and approval from senior leadership?
Yep. I could take this one, Bryce. So, the differing needs between the stakeholders and the consumers, and I'm only speaking from what we learned internally, but also speaking to a lot of our peers, my peers throughout the country, is that the way we approached this, we wanted to know what the consumer wanted. And then we backed up our recommendation to senior leadership and the stakeholders with data. So we need an app. It's going to cost this much money, and here are the features that we want to roll out, and these are the reasons why. And every point on that had 60% of our users coming to the website are on a mobile device. 83% of the people visiting our website are going for these 3 reasons. So with that, we needed to pull all of that into an app because that's how people are finding us. So that's how we did it. I'm not saying that's the way to do it. That's the best way to do it, but that's what worked for us internally. And we're continuing to do that. And, we're finding our physicians and our executive leadership team are all very analytical. They're all extremely intelligent. And as long as you can back it up with some form of research and, the truths that are in our numbers that we can very clearly see, traffic to our different digital interfaces, that's how we back up and get support for what we need and what we're recommending.
Great. And then another question, kind of a 2-parter here, is how are you measuring ROI on the app? And then what type of analytics are you using as well on the app?
Sure. So I can take this and then you can talk about the analytics because you guys really helped us, Bryce, get to that. So how we're measuring ROI right now is solely through MyChart and online scheduling. So when we are working through our KPIs for FY21, really getting into FY22, we're on a July 1 is our fiscal year. We're looking at conversions. So conversions of online searches that are resulting in appointments. And then we're working with finance on what that downstream looks like. We can allocate out the time saved for someone having to call in and somebody has to drop everything at the front office and schedule an appointment and back and forth versus somebody just doing a quick Google search on their phone, scheduling an appointment. That's one major way we're proving ROI. And the second is through MyChart utilization. MyChart has done a lot. Epic's done a lot of ROI research on their end, and they have savings anywhere from $25 to $30 per patient per year is what is saved with each MyChart activation. So right now we have about 30, I don't want to get the number wrong. It's a lot. We've got about 34,000 active MyChart patients. So if you multiply that by $27, if you just take an average, I mean, right now it's a significant savings. So within MyChart, and I would imagine with most EMRs, there are probably 50 different KPIs we're measuring just out of MyChart alone, from e-visits, online scheduling, to geo-targeting, tell us you're coming, online forms. All of that can be tied back to dollar savings with efficiencies on the back end. And we're looking at that in real time. Every month, we're reporting it out to our board and to our senior leadership teams. And with every one of those tick marks, it's allowing us a little bit longer of a runway to keep moving in the digital direction that we know we need to be heading in. As far as the analytics is concerned, there's a lot of different analytics. Bryce touched on this briefly, that it's not super easy to pull analytics out of Apple and Google. Privacy is huge. I'm sure with the new iOS update, you saw that it's no longer a function where it's turned on. You have to turn it back on to be able to provide analytics back to the end users or the owners of the app. But we did work with Bryce's team, and they did some very complicated, amazing things to build a dashboard for me that I look at every day. But I don't know, Bryce, if you wanted to talk about that for a minute.
Yeah, it's not simple. There are sort of 3 big components to getting data on an app like this. One is the App Store data, which we already talked about. You getting your crash numbers, your installs, your uninstalls, your all of that type of stuff that you would expect from the App Store, engagement related stuff. Then we also use some Google tools to anonymously get data on interactions within the app. But that is only related to the things that are not MyChart functionality. So the third component is MyChart data, and Epic is capturing all this data on MyChart, and you probably already have that somewhere. The problem is they don't differentiate that data between mobile app MyChart usage and interactions versus non-mobile app. So it's just one, this user used MyChart in this way at this time. So we had to go in and work with the MyChart team to get the app specific data out as best as we could, and then figure out a way to use BI tools to bring those 3 components of the data together and give meaningful assessments of, okay, based on all of this coming together, what's actually happening? What do we think is driving different results? Whether it's something positive that we're seeing happen, like deeper engagement, or a breakdown or a bottleneck in the process for users. So that it's been interesting. We could probably do an hour-long presentation just on that, you know, getting all that data together and figuring out the tools to use and bringing it to a place where we could ultimately put a dashboard in your hands, Taylor. But there's certainly a fair bit there.
Great. I want to thank you guys once again for presenting this afternoon. It was a great presentation and a lot of good information. Once again, if we didn't get to your question, we can reach out individually to get you an answer. Thank you all for attending the webinar this afternoon. And again, thank you, Modea, for sponsoring today's presentation. Everyone will be receiving a recording of the presentation and a copy of the slides tomorrow. And both Bryce and Taylor's contact information is in the deck for you all if you have any other questions. And please remember, there is a brief survey, and we would really appreciate your feedback. Thank you once again, and have a great afternoon.
Thanks, everybody.
Thanks.